I would like to acknowledge the Gurnai Karnai people whose land this presentation is being made. I pay my respects to elders, past, present and emerging. We'll be looking at a case study of a young Aboriginal woman who has FASD and now showing signs of reactive depression. We will look at some of the factors that contribute to depression and the help and support that is available in Australia. The Aboriginal Patient Health Questionnaire and the systematic tailored assessment for responding to suicidality will be used for assessing the risks and the extent of disease. A mental health care plan that promotes choice, autonomy, and is culturally sensitive and appropriate will be developed. There will be a reflection on my learning and professional development after studying this unit. So Liz is a 20-year-old Aboriginal female living in regional Victoria. She was diagnosed with fetal alcohol syndrome disorder at age 7. She's been brought into the GP clinic by a neighbour who had concerns because he had not seen her leaving the house for several weeks. She presented with an unkempt appearance. Initial observations were that she had a dry mouth, sunken eyes, and poor hygiene. She looked fatigued and her speech was slow and limited. She is currently taking 30 milligrams of Ritalin twice daily and 4 milligrams of risperidone and 5 milligrams of melatonin as required. A diagnosis of reactive depression was made. According to the Australian Institute of Health and Welfare, approximately 20% of the Australian population are diagnosed with a mental illness. 6% of these people will have a depressive disorder. The financial costs during 2022 and 2023 was $18.2 billion. The breakdown of this is $8.1 billion comes from state and territory governments, $1.5 billion from Medicare for mental health, and there is $691 million paid out for subsidised prescriptions. Mental illness and suicide combined in terms of diminished health and reduced life expectancy is around 150 billion. Globally, 5% of adults have a diagnosis of depression, and there are more women than men. The contributing factors for depression can be adverse childhood experiences, having other mental health issues and disabilities like autism and ADHD, during menopause and postnatal periods, stress, trauma, and having experienced domestic violence or breakdown of a relationship. Other factors can be hypothyroidism, personality traits that cause a person to have low self-esteem. There are high incidences of depression for those living in rural and isolated areas and the Indigenous population. The helps and supports for depression are GP mental health plans to help reduce costs, community psychiatric nurse teams, medicines like antidepressants, cognitive behavioural and other kinds of therapy, relaxation, yoga, walking and other exercises. So these assessments have been chosen because they are ones that are good to use with Aboriginals. The Patient Health Questionnaire will ask questions like, have you been feeling your spirits sad? In assessing the risks for suicide, the STARS tool is a good one to use because it is evidence-based and client-focused. It can be used by both clinical and non-clinical workers. Other background information is that Liz has a history of child protection involvement. and has lived with her stepmum until she was 18. Her biological mother continues to have alcohol issues. Liz has friends and aunts and uncles in the Gooney community. When doing mental health planning, looking at the person's strengths and risks is necessary. Strengths for Liz are her community supports. Her connection to the Gooney mob means that she has elders as well as her foster mum who wants to support her. The risks for Liz are that fetal alcohol syndrome disorder means that she can make poor choices and act impulsively. Pharmacological interventions are that, as well as taking her medication for FASD, Liz is now on 20 milligrams of fluoxetine. This is an SSRI antidepressant. This dose can be increased if required. Non-pharmacological interventions that would benefit Liz would be counselling, as this would enable her to speak with someone about her life with FASD. Dialectical behaviour therapy can be good for people with FASD because it helps them to regulate their emotions. To monitor the progress and outcomes of the mental health care plan, the Kessler Psychological Distress Scale K5 will be used. This tool is appropriate for Aboriginals. Another way to monitor progress and outcomes is by having care team meetings where those involved can provide feedback, doing care planning updates and reviews. Liz will be encouraged to have an input in the care plan. She will be advised about her treatment options. Factors that need to be considered are that people with FASD and depression have unique experiences. She will be encouraged to develop self-help measures that will allow her to work towards managing her mental health. The care plan will have a focus on recovery and take her culture into consideration. So in the care plan itself, her contact details will be documented. Her treatment plan and assessment results need to also be added. Current issues and medications will be written in. Details of the results of the APHQ-9 and STARS that we use during the assessment phase are recorded. The STARS has sections A, B and C. A notes if there is suicidal ideation, B identifies risk factors for suicide, and for Liz, her risks were noted to be that she lives alone, has had past traumas, and that FASD is a chronic disability. Part C of the tool looks at protective factors, and these were her good relationship with her foster mum, and that members of the Aboriginal community that she belongs to. Details and risks and comorbidities and the diagnosis have also been recorded in a separate part of the care plan. The goals that have been set by Liz and recorded in her own words. The treatment section is being used to record how these goals will be met. The practitioner has asked for Liz's consent to commence an application for NDIS funding because this will help to support her with activities of daily living, maintaining her home and being able to live independently. The plan will also have a review date. So doing this unit has helped me learn quite a bit about legislation and the financial burden of mental health. I am more aware of services that are available for my clients. I come across children and adults who have FASD in my job as a case manager in family services. I have a better understanding now of the condition and feel more confident when engaging with them.